We're very privileged to have Dr. Lubna Zahir on to be able to give us some very important travel tips as we're about to enter the holy season. So the point of this webinar is to give all the pilgrims who will be traveling just very important health information and tips as they prepare for their travel, along as they spiritually prepare for their trip. So without further ado, I'd like to hand it over to Dr. Lubna Zahir.
Thank you, Marium. First of all, Assalamu alaikum, everybody. I would like to congratulate all of you who on accepting the special invitation to perform Hajj this year, inshallah. This trip will be, I think, spiritually fulfilling, and you'll be able to, hopefully you all will be able to return back home to share your rich experiences with your family and your community. As you embark on this momentous trip, there are many preparations that all of you will be doing. I'm sure at the masjid, in your homes, at work, to ensure a smooth trip. One of the most important things that we need to do while performing Hajj is to take care of our health. I hope everyone remains healthy throughout their pilgrimage at Medina, Mecca, and at Mina, and we need to be prepared for all our health issues, inshallah. So we at IMANA decided to put together this webinar to help you navigate all your medical preparations as you embark on your Hajj trip. As we know, that all preparations are in full swing now because Hajj is 9th to 14th August this year, inshallah, 8 to 12 Dhul-Hijjah. And over the last few years, there's been an increase in the influx of Hajj pilgrims. Alhamdulillah for that. 2017 saw 2.3 million, 2018 saw 2.4 million almost, and roughly about 12 million people go to Saudi Arabia for Umrah and Hajj annually. When looking at the demographics, it is projected that in 2025, we will have 17 million people going to the Holy Land for Hajj and Umrah. That is the most visited place on earth now. So before we go to Hajj, you have to get a visa. And the Royal Embassy of Saudi Arabia here in Washington, DC requires that you have a meningitis vaccine and a polio vaccines. But these are the two absolute requirements prior to getting the visa. But these, of course, are not the only precautions that all the pilgrims should take. So when we look at travel immunizations, in order to maximize your health protection, we have two types of immunizations. One is a routine immunization, and second one is travel-specific immunizations. Routine ones are the ones you get at your doctor's, but we'll go into the travel-specific ones initially, and then kind of circle back to the routine ones. So the first one, we're just going in no order of importance, is hepatitis A. Hepatitis A, as a lot of you know, is a foodborne illness. It is usually transmitted through unhygienic food and water consumption. And what you do get is jaundice, which is a yellow discoloration of the eyes, the sclera. You have some fever, belly pain, nausea, vomiting, feel extremely weak. So I'm a big proponent of taking the hepatitis A vaccine, especially if you're planning on eating street food, staying around for Hajj a little longer, like other than the short 2-week travelers, people who stay for about 6 weeks, or traveling to see friends and family after you complete your Hajj. The second one we're going to talk about is typhoid, and typhoid also is a food and waterborne illness, also transmitted through unhygienic cooking practices and water practices, all very common. When you're in Mecca, Medina, you can do the vaccination through a tablet or an injection. You can just ask your primary care provider for either of those two, but the tablet is a little bit more finicky. You have to keep it refrigerated. You have to take it on specific days over a 3 to 5 day period. So I kind of like to recommend the injection. It's just once, come to the office, get it done, and you're done for it. So I'm a big, again, proponent for the typhoid vaccine as well. The third one is influenza. Everyone knows about the flu shot. We know that the risk exists from November through April, but remember, off-season transmissions often occur. So if you are immunized already with the current vaccine, which would be the 2018 vaccine, then you're good. But if you've been immunized early in the season, so for example, if you started in October or September and 6 months have already passed, then you really need to be revaccinated because the immunity does decline. So among the people who are most high risk are the ones who are immunocompromised or older parents' generation who would be going for Hajj. So we always recommend that to get revaccinated and also carry with them the baloxavir, which is the Zofluza or the oseltamivir, which is the Tamiflu. So go ahead and have it written as a prescription from your doctor. Fill in the prescription and take it with you. Because when we go, you might be in Mina and you're having that high fever, and it might be hard to get the medications at that time. Next one is the hepatitis B. Now, hepatitis B is a blood-borne illness, which is usually by contaminant needles. But what we are seeing is that in Hajj, the high risk is for pilgrims who use unlicensed barbers to shave their head. So often there are long lines with the licensed barbers, and you might be in a rush and take an unlicensed barber who has those knives that they use to shave the head, which can cause cross-contamination. It has been reported, so we always recommend check your titers or make sure you've had the vaccine on board. And of course, if you are a healthcare worker working in the clinic during Hajj season, you must have that hepatitis B vaccine. Coming up next is the MMR, or the Mumps, Measles, Rubella vaccine. There is a current outbreak both here in the United States and in Saudi Arabia. So this vaccination is getting a lot of attention now. So if you have a child 6 to 11 months, you only need 1 dose. However, if they're about a year old, they either need evidence of immunity, which is usually a blood test, or 2 actual documented doses of MMR. So if they only had 1 in the past, then a second one is needed within 28 days of the first dose. Important because of the outbreak and the efforts to contain the disease. Another new concern is polio. This is recommended for all Hajj and Umrah pilgrims. Again, there is outbreaks happening in certain parts of the world, and the adequate primary series is in childhood, which we've all had, and then 1 adult dose. Of course, they do require the proof of vaccination, which is 1 month to 1 year prior to departure from your home country. And if you're coming from certain countries, then this becomes a very stringent requirement. And these countries include Afghanistan, Burma, DRC, Mozambique, Nigeria, Pakistan, which we see a lot of relatives coming in and out from, Papua New Guinea, Somalia, Syria, and Yemen. So all the travelers coming from these countries direct. So if you're meeting any relatives from any of these countries and you're meeting them in Jeddah, these people will receive 1 dose of oral polio at the border points. And it doesn't matter what their vaccination status is. Remember, all these measures are to contain the disease, promote herd immunity of the polio. We don't want to see the resurgence of this disease. Coming up next is rabies. Now, you might think, rabies? Why? But honestly, the risk from dogs do exist, and it has a widespread distribution over in Saudi. So the vaccine is, of course, recommended for people who are going to stay there for a longer time, going to rural areas, and young children. Because remember, children are more at risk because they tend to go ahead, pet the little kitten, pet the dog on the street, and never report any scratches or bites. So we do recommend it for, a sub-select population. Now, this one I think everybody does know about, which is the Meningococcal Meningitis vaccine. This vaccine certificate is necessary, it's mandatory, your visa will not be approved without it. So it needs to be not more than 5 years or less than 10 days. So every traveler needs it, 2 and above. Most of the time, a quadrivalent vaccine, if you have it 3 years and you have the certificate, you're good with it, especially for repeat Umrah travelers. I'm sure everybody's had this before they apply for their visa or at least get it. Coming back to the routine immunizations. Now, routine immunizations are immunizations that you get or the shots that you get, which is not for any travel, it's just for general health. And even though we are traveling to Saudi, we do want to make sure our general health is up to date. So the tetanus, the diphtheria pertussis, which is the Tdap, the pneumococcal, and the varicella, which is chickenpox, the 3 main ones which I thought were pertinent to our discussion today. So when you look at the Tdap, the reason why we are recommending this now every 10 years is because there has been a big increase in pertussis worldwide. And if the pilgrim already has a tetanus or a TD on board, then you really need a dose of Tdap because the pertussis component is what we need. As the pertussis, remember, is whooping cough, so it could be one of the reasons why you're having a cough. And if we can prevent that cough from getting to you during Hajj, that is paramount. Because we know most of our friends and family, when they come back, most of them have upper respiratory, some sort of a nagging cough that stays on for a while. So I'm a fan of the Tdap, and make sure you are up to date on that. The pneumococcal vaccine is usually for adults 65 and older, and the pneumonia vaccine is 2 types, which is a Prevnar 13 and a Pneumovac. And this, again, is easily available at your primary care. It's a routine immunization. All patients usually get it, and especially people who have chronic diseases, diabetes, long-standing kidney disease, or any immunocompromised adults who really need to take the vaccine. Then the last of the routine immunizations, we come to varicella, which is chickenpox. And this is really indicated for all people who are born outside the US or born within US after 1979. Now, if you've had 2 lifetime doses, you're okay. Or if you know that you've had chickenpox, like for example me, I clearly remember chickenpox, then you do know that you've had a previous infection, you're okay. And then lastly, if you don't know, not sure, can't remember, then you can just get a lab titer done, and that just confirms whether you are immune or not. Again, I included this in the presentation because varicella, very contagious, better to be immune before you go on a long trip, uncomfortable, and has a little bit of a prodrome. Coming to non-vaccinated diseases, malaria. We know malaria, vector-borne, spread by mosquitoes. It's predominantly P. falciparum in Saudi Arabia. And the good thing is that Mecca, Medina, Jeddah, Taif, Abha, and Yanbu, which is the main places where we visit during the Hajj pilgrimage, is not a malaria zone. So the chemoprophylaxis, which means that you take the malaria pills before traveling, is only in Asir and Jizan. So if you're going there after to see friends or family or for any other reason, then you do need to take the prophylaxis. Otherwise, you really don't need that. But if you develop a fever within about a 3-month period from traveling from any area or being in the plane, you must always get immediate medical attention and discuss your travel itinerary so that the doctor knows your travel history. Now, coming to traveler's diarrhea, moderate risk exists through the country, but we all know people who have come back from Hajj and Umrah who've had traveler's diarrhea during their stay. And remember, it doesn't matter if you're staying at the Fairmont or in some fabulous 5-star hotel, your risk remains pretty moderate to high. So food and water precautions are extremely important. And what does this mean? Just be careful with what you eat. Don't be eating food that's been sitting outside, drinking water which you're not sure where it's coming from. And I always think that all travelers should carry loperamide, which is Imodium, just to treat yourself, and add on azithromycin, which is the Z-Pack, if your diarrhea is severe, which means if you had more than 6 or 7 episodes, you're in Mina, you have to travel, you're in Arafat, I think it's important that you carry that Imodium with you. Your primary care physician can easily write this Z-Pack or azithromycin prescription, and it should be part of your travel medicine consult with them. Last, or almost last, is the MERS, which is the Middle East Respiratory Syndrome coronavirus. Got a lot of attention, and efforts to prevent MERS at Hajj have been implemented and successful. So there have been no MERS cases reported during Hajj with Hajj pilgrims, but I wanted to kind of include it for completion. Coming to the next, vector-borne illnesses, the rest of the mosquito-borne illnesses, which we hear about all the time, Zika, chikungunya, dengue. Remember, these are from the Aedes aegypti mosquitoes, so they are daytime biters. The P. falciparum ones are nighttime biters. So really, insect repellent and being covered is the best defense right now. There is a low risk of transmission in Saudi, so I just wanted to make sure people, do know about it anyway. But while we have vaccines and we have vector-borne diseases, not all these can be controlled and protect you from all the diseases that happen in Saudi Arabia. There are some travel behaviors which I feel are very important to stay healthy and to be safe during your Hajj trip. So always eat and drink safely, prevent the bug bites, keep away from animals, reduce exposure to germs, and avoid non-sterile medical cosmetic equipment, and always select safe transportations. We'll just go through a couple of these. So number 1, the bug bites. Mosquitoes, ticks, fleas, all these can cause a bunch of diseases which really we can't prevent by vaccines or medications. So we can just reduce the risk of acquiring them by covering your skin, use insect repellent, And remember, you have to use about 20% or more DEET and picaridin. And then if you want to be a little bit more on the natural side, just use an oil of lemon or eucalyptus. They all work. But remember, if you are actually bitten, avoid scratching it and apply a calamine or a hydrocortisone so that you can prevent that itching and a possibility of secondary infection, because we are always traveling, always on foot in the tent city, less than ideal conditions. Next is just reduction of exposure to germs. Always wash your hands. You can use a hand sanitizer. I know when I went on Hajj, I kept a small one in my abaya. Use soap and water. Cover your nose and mouth when coughing and sneezing. Really important, especially since you are in a lot of crowded areas. And avoid contact with sick people as much as you can, of course. But if you yourself are sick, you really should stay in your hotel room and not be exposed different others and make yourself worse. Now, this you might feel like, why is she talking about this? But select safe transportation. The reason is the data tells us that motor vehicle accidents, which are car accidents or bus accidents, are the #1 killer of United States citizens who are healthy in foreign countries. So basically, while walking, pay attention to the traffic around you, especially in really crowded areas. Choose newer vehicles with like better safety measures like seat belts. The buses are sometimes less than perfect, but the best thing I feel is just use a lot of common sense at all times. So the personal medical care kit. This is something I tell my patients. I have a little handout and I give that to them, that they must always carry these over-the-counter medications in a separate pouch. And I want to make sure that everyone takes this to Mina. So it's packed into that backpack that goes to Mina. This should include, but not just this. If anything else is there, that's fine. Benadryl for any allergic reactions that might happen, or just over-the-counter hydrocortisone cream or lotion. Tylenol, Advil for headaches, light anti-inflammatory, Band-Aids, ACE wrap in case you get a foot sprain or a wrist sprain, Neosporin for antisepsis, alcohol wipes to clean all wounds and scratches, a lidocaine spray or patch because some people do develop low back pain and which might be irritating, a knee brace because there's a lot of walking. If you're an asthmatic or a COPDer, an inhaler, and an EpiPen is what I prescribe to my patients. And just because you never know when you are in a place that anyone who might, for yourself or anyone else who might get an allergic reaction, especially to any kind of bug bites. And the motion sickness medications also available easily over the counter. You need to pack this in a separate pouch, put it into your Mina backpack, and always have a mask. Of course, use the mask at all times, except at Tawaf, because that cough, cold, the upper respiratory infections that we see, that nagging, brassy cough later, it is a pretty common sight in while performing Hajj. In addition to that, you must know how to get medical care at Hajj. So what I like to also say is list all the medical conditions you have, the allergies you have, and the medications you are taking on a daily basis. Put it into the Google Translate, print it out in Arabic, and carry that with you. If you have a heart condition or any kind of cardiac disease, take a recent electrocardiogram or an EKG copy from your doctor and keep that with you. Also, you can keep it on your phone, and both the list as well as the EKG. Have adequate travel medical insurance. It will pay dividends. It just in case, should you need it. And when we went to Hajj, my husband and I, we did take evacuation insurance for any serious medical events. So there are many vendors for this, and it doesn't really cost that much, but it's not a bad idea just in case anything untoward should happen, but unlikely. This is just really for giving you the whole idea. The last one is like, ask your travel agent for the location of the local clinic and hospital, all at Mecca, Medina, and at Mina. So you really should know where you should go just in case anything happens. When I was at Hajj, there was a lot of people who were passing out and fainting, nausea, throwing up. So at least if you can always help your fellow Haji if you yourself are feeling well. Most of the travel agents are excellent, and they do take care of all these things, but I feel it's always better to be proactive and ask them, where is this place? How should I be able to go there? What is the phone number? Can I put this in my phone right now, so that you are well prepared? And of course, after your trip, inshallah, you've done your Hajj, you are well, you're coming back home, but remember that plane is a petri dish of infection. Make sure you wear your mask throughout the plane ride on your ride home. If not, keep your rubatta or a scarf over your nose and mouth, because people on that plane are sick, they are coughing, and it is, even if you stayed well during Hajj, you may get that infection on the plane. If you are sick after Hajj, when you come back, make sure you tell your doctor what your recent travel itinerary was, where all you went, and any other specific illness that you might have had during the time. I hope that this short presentation will be helpful on your journey ahead, and that I hope everybody comes home healthy and happy from the best possible trip of their life, inshallah. Of course, thank you, Marium, for always being there and as part of the IMANA Education Committee. And here are some sources that I have used, and you can always access them when you like. Thanks.
Jazakallah khair so much, Dr. Zahir. This was incredibly helpful, incredibly useful. We just pray that inshallah, everyone is able to gain some benefit from this presentation. This will be a recorded webinar that will be on our website, so feel free to go back to this webinar if you have any other questions, and you can always reach back out to IMANA and our education committee if you have more specific questions before and even after your trip to Hajj, inshallah. May Allah bless your trip, and inshallah have safe travels there and back home. Thank you so much all for your time. Assalamu alaikum.